Hello, welcome back to another episode of Hybrid Healing Hour. Today we're going to talk about reversing hypertension. So what is hypertension? Well, it's also known as high blood pressure. And this is when your blood flows through the arteries at a higher than normal pressure. So blood pressure is a vital sign for a reason. Lizzie always says that in our office. And today we're going to talk about why it is a vital sign. Why is this so important? And why do we check it every time people come into the office?
Yeah, so one of the first questions people ask us is, what is normal blood pressure? For many, many years, we said normal blood pressure is 120 over 80. And that's kind of arbitrary because really I consider normal blood pressure to be 115 over 70 and 120 over 80 to be kind of the upper limit of normal. And then you get into stages like pre-hypertension, stage 1 hypertension, and stage 2 hypertension later on. Blood pressure is made up of two numbers, as we know. The higher number on top, which is the systolic blood pressure, and the lower number on the bottom, which is the diastolic blood pressure. Systolic blood pressure is the pressure that you get when the ventricles in your heart have contracted, right? When they're squeezing all the blood into your arteries. Diastolic blood pressure is the pressure between heartbeats when the heart is filling with blood.
So believe it or not, the organ that largely controls blood pressure is the kidney and not the heart, like many people think. This is due to something called the RAS, which is the renin-angiotensin-aldosterone system. This is very important for the regulation of vascular tone in our arteries and the balance of salt and water in our body. This is also a critical regulator of blood volume, as we most people know that water follows salt, and so that therefore can increase or decrease, depending on your levels, your volume of the blood, which is the amount of blood in the blood vessels. It also is a regulator of electrolyte balance and systemic vascular resistance, or which is the force of blood going through the peripheral arteries. And when we say peripheral arteries, we're talking about the arteries that go to your extremities.
Yeah, and as most of you who have been listening to our podcast from the beginning know, that my training is in nephrology. So I did a nephrology fellowship, and that's pretty much what we did in our clinics. We treated blood pressure. We treated high blood pressure. We treated resistant blood pressure. A lot of our patients come to us and say, I have high blood pressure. Should I be seeing a cardiologist? And yes, cardiologists can treat blood pressure, but that is not their primary field. Whereas if you see in a nephrology practice, it'll say nephrology and hypertension. In fact, it's interesting that the kidneys are so involved with blood pressure that there were patients that we had, these are dialysis patients who didn't really have functional kidneys, but they still had kidneys causing problems, where their blood pressure was so resistant that we ended up doing a bilateral nephrectomy, which is removing their kidneys, and their blood pressures normalized in most cases. That's how significant the role of the kidney is in hypertension.
That's fascinating. I always found nephrology to be very interesting. So hypertension is actually the most common chronic condition seen in primary care offices. And many people, I'd say most people out there who have hypertension don't even know it.
It's true. I mean, hypertension is a major independent risk factor for so many different conditions. It's a risk factor for coronary artery disease, for stroke, for heart failure. Congestive heart failure is related to blood pressure, for arrhythmias like atrial fibrillation. Diabetes even can be a result of hypertension, and kidney failure. And there's even a lot of evidence that shows that vascular dementia can be related to hypertension.
So we know it does start in the smaller blood vessels, which is known as the microvascular system. So microvascular disease can affect and lead to vision loss, as you think about all the small arteries you have in your eye. Peripheral vascular disease, as we already said, the arteries and blood vessels in your extremities, like your toes, your fingers, and even erectile dysfunction.
So let's talk about some statistics of blood pressure. 1 in every 3 American adults, or approximately 80 million adults, which is 31% of the country, has hypertension. Worldwide, it's 1 billion people with hypertension. A person over the age of 55 years has a 90% lifetime risk of developing hypertension. Hypertension accounts for 18% of cardiovascular disease deaths in Western countries. High blood pressure costs our country about $48 billion each year. In 2014, the 8th Joint National Committee, JNC 8, published the evidence-based guidelines for the management of high blood pressure in adults. So it was about 13 years when the previous recommendation came out, and I have a feeling that this will probably be the last recommendation. I don't think that they're going to be making any more Joint National Committee recommendations after this. So these are the criteria that we use. We target blood pressure, and the target systolic blood pressure typically in most practices to start pharmacological therapy for subjects younger than the age of 60 is greater or equal to 140 millimeters of mercury systolic or greater or equal to 90 millimeters diastolic.
So let's talk about some other causes of hypertension.
First, like everything else that happens in our body, is inflammation. Inflammation is everything. Inflammation is one of the major leading factors of the cause of hypertension.
And sometimes that is due to gut dysbiosis, as we talk about frequently.
And insulin resistance. We don't think of blood sugar as, we always think of salt as being the problem with hypertension, but really blood sugar plays a gigantic role. So insulin resistance can lead to hypertension. And
actually, I just heard there was a study done last year where they're kind of looking at the vice versa of that and saying that hypertension might be actually causing diabetes. But they need more evidence for that. But I thought that was very interesting because I've always thought the opposite.
Sleep apnea is a major problem in this country. There's so many people walking around with undiagnosed sleep apnea, and sleep apnea is a huge factor in causing hypertension. And along with sleep apnea, you also have obesity, which is a major issue.
Smoking. And believe it or not, there are still people out there smoking. And another one that people don't think about is heavy metals. Especially lead and mercury, which is usually found in our food sources or exposure of some other sort.
And even nutritional deficiencies, omega-3 deficiency, magnesium deficiency, potassium deficiency, all those three play a huge role with blood pressure control.
Now, more on the physiological side is, like I mentioned before, the RAS-driven blood pressure issues. That's based on the renin-angiotensin-aldosterone system. Versus sympathetic driven, which is usually due to anxiety, exposure to trauma, stress, or abuse. And so sometimes people come in and they constantly have high or persistent high blood pressure. And, we can throw them on meds to treat the blood pressure. But in reality is we sometimes can just treat their anxiety or get their stress levels down. So sometimes there is also a condition out there called pheochromocytoma, and it is it's a neuroendocrine tumor in the adrenal gland that's relatively a rare cause of hypertension. But sometimes if we check levels, because we're going to get into how to check levels down the later, but if you check levels and they might be mildly elevated and possibly indicative of pheochromocytoma, it doesn't necessarily mean that's what it is. We've seen where you can treat the anxiety and they improve their blood pressure.
And then you also have vascular aging, which is stiffening or hardening of the arteries, which happens as we get older.
So what is the right way to measure blood pressure? Because I see this done incorrectly frequently.
So one of the things that we consider in our patients who have very resistant blood pressure monitoring, and it's not very common to see doctors who offer this to their patients, is something called a 24-hour ambulatory blood pressure monitoring. And that's actually probably the most accurate, gives you the best results. But that's not feasible for most patients to get because it's hard to find someone who's able to do that. So there's other things we can do.
Yeah, I like to get an average of blood pressure readings for my patients while they're at home because that's the environment they're used to. Or if you're at work a lot, have a blood pressure monitor at your job and you can check your blood pressure there. The best way to do it is to have a blood pressure cuff that can check your readings 3 times back to back. You ignore the first reading, and then you take an average of the second and the third. Other points that people don't realize, it's very important to make sure you have proper positioning of your body. You want to make sure your feet are flat on the ground. your back is upright, and you want to make sure you have a blood pressure cuff that fits the arm properly, not too big, not too small. And usually on blood pressure cuffs, there's a line that we know that it has to fit between. And then you don't want it over the clothing. So ideally, you want to raise up and have it properly positioned on the bicep. I do like upper arm blood pressure monitors and cuffs better than the wrist monitors. I've seen those to be more inaccurate. And you want to sit there for about 5 minutes before you hit start.
I would say that only about 25% of doctors' offices are actually measuring blood pressure correctly. And this is a problem. You can't make a medical therapeutic decision on something when you have inaccurate numbers to go by.
A lot of times it has to do with the positioning of the arm. Your arm should be at rest and not hanging down below or anything. And you want to have it ideally at rest at the height of your chest. So I even tell people, okay, sit at your kitchen table and rest your arm on the table if it's sitting at chest height, or even in sitting on your couch and have it resting on the arm rest next to you if it's around your chest height.
And the other thing is you can't make a diagnosis of hypertension based on just one blood pressure reading. You need at least 2 readings, and that's at least 2. I would get even more, and preferably spaced apart, not on the same visit. You do them maybe spaced over a month or a couple of months before you can actually say someone has hypertension. So one of the first approaches of treating someone with blood pressure is, like we said, diet. Diet is crucial. And then there's the DASH diet, which is the most commonly accepted diet for treating hypertension. And DASH stands for Dietary Approaches to Stop Hypertension. And the nice thing about this diet is it requires no special foods. It just gives you daily and weekly nutritional goals.
Right. It just is explaining or recommending to make sure you're eating your vegetables, your fruits, and whole grains.
And that's including fat-free or low-fat dairy products, fish, poultry, beans, nuts, and vegetable oils.
Limiting your foods high in saturated fats, such as fatty meats, full-fat dairy products, and tropical oils, such as your palm oil, palm kernels, and coconut oil.
And you have to limit sugar, especially sugar-sweetened beverages and desserts.
Choose your foods rich in potassium, calcium, magnesium, fiber, and protein.
And then lower your dietary sodium. So the recommendation ranges between 2,300 milligrams of sodium a day to 1,500 milligrams of sodium a day. And sodium is hidden in so many things. There's so many foods out there that you don't realize. Just because you're not adding salt to food doesn't mean that there's already not a lot of salt in there. And actually, the processed foods are the worst culprit when it comes to hypertension.
We mentioned before testing. So what are some tests that we can do to see if the hypertension is affecting the kidneys or other organs of the body?
Yeah, so we want to start with making sure that their kidneys are functioning well and working. I know most practices do the creatinine and the GFR, which is the glomerular filtration rate based on the creatinine. We prefer something called the cystatin C, which we believe is a little more accurate in people who either have a lot of muscle or not enough muscle. And along with the kidneys, we also check urine for a urine microalbumin to see if they're spilling any protein in their urine.
Which is a sign of some kidney damage. Another one I like to check is the plasma renin activity aldosterone ratio. And this is a test that we can see if this once again is responding, if their blood pressure is due to the RAS system. And we can see if they would be responding well to certain medications that affect the RAS system. Also, the CYP1A2, which is a caffeine metabolizer. I found when I learned about this, I thought it was really interesting. This is actually to see if your body metabolizes caffeine, and that could tell us if you drink 3 cups of coffee every day and your body's not metabolizing that could strictly be the cause of your high blood pressure. And
then we talked before about how intimately diabetes and insulin resistance is associated with hypertension. And hemoglobin A1C is another test we check, which unfortunately a lot of people are only having hemoglobin A1C checked if they are a diabetic. Unless they're diabetic, they don't get that number done, but it's a good number to know.
And another one that's not a blood test is checking your visceral fat number. Once again, this is correlated with obesity and often associated with hypertension.
And there's plenty of places that offer in-body testing or other tests that you can find your visceral fat level based on that.
A lot of gyms are doing it now.
And I think GNC is too. So, and then sleep studies. We do a lot of sleep studies in our practice, and I think sleep studies need to be done probably more. So if you have hypertension, if you're overweight, if you snore, if you feel tired during the day, you really should have a sleep study done. And it's so easy now. They have home sleep study testing. You don't have to go to a place and sleep in a strange bed. You can do it at home with a little portable unit. Some of them are disposable. You just take it home, wear it overnight, and then throw it away the next day. But they're fairly accurate, and they're good tests. And you want to know, if you have sleep apnea, it's something that's easily treated, and it's something that can cause a lot of problems if it's not treated later on.
I think it's highly underdiagnosed as well. So the reason we're doing this podcast is, as we said in the title, reversing hypertension. Obviously, we would love for people to reverse hypertension, not have to go on medications. So let's talk about a few treatment options. And going back to that, we practice and we believe every illness in this country should be treated with diet first.
Yep. And if there's one takeaway point for every podcast we do, it's diet comes first over everything else. And why does diet come first? Because diet decreases inflammation, which is the second goal, is to decrease inflammation.
Another thing that can help lower your blood pressure is by increasing your dietary potassium, as we've already mentioned a few times. And some foods that are high in potassium is avocado, spinach, beets, potatoes, including sweet potatoes and white potatoes.
And avoid processed foods. For so many reasons they're bad, but hypertension is definitely one of them.
I think a lot of it has to do with how it can completely ruin your gut lining and cause leaky gut and gut dysbiosis, as well as the salt content in processed foods. Exercise. I think that's obvious. We always want people to exercise, not only just to be healthy, but, we talk about cardiovascular health. I mean, that's in the word, do your cardio.
And a lot of people think of exercise as being aerobic exercise, right? Cardio exercise. But no, muscle building is crucial. So we're big fans of weight training, resistance training, and even isometrics. There's so many, and walking is fine too. But are we telling you to go out and go jog and go running? No.
Yeah, you don't have to run a marathon to be healthy. And I mean, the way I like it to look at it is you can get your heart rate up just briefly by doing, your weight training back to back. And you could do just like 15 minutes of HIIT, which is high intensity training. So it's not very much we're even asking.
And then you need to get adequate sleep at night. There's great biometric devices that can track your sleep, but you need to know, are you sleeping well? You may think I'm in bed for 8 hours, but is that truly adequate sleep? And then we talked about sleep apnea. If you have sleep apnea, then you really should be using your CPAP machine or whatever you are using to treat sleep apnea, whether it's a oral appliance. But it needs to be got under control.
If you smoke, stop smoking, please. There are many, many problems with smoking, but it is very obvious when I have patients come in about 30 minutes after they smoked a cigarette on their way to our office and their blood pressures are high. And it's not just transient. It's a very complex process, but it can create chronic hypertension. And also, if you do have heavy metals, we want you to go through a chelation process to get rid of the toxic metals in your system and also learn where they're coming from so you can decrease your exposure.
Yeah, actually, lead and mercury toxicity are more prevalent than people think. So they're out there. And then you need to lower your stress levels, right? There's so many ways. I mean, stress is in our lives. We can't get rid of it, but you can help mitigate it by things like meditation or yoga. Meditation is a great tool. There's so many apps out there. There's so many ways to learn how to meditate.
The last one on our list, and then we did this on purpose, is medications. So tell us about a few medication options. If we've tried all of these things and people still have high blood pressure, what are some options we can start them on? Yeah,
so exactly. Medication is last because in so many patients who go see their doctor and have high blood pressure, that's number one. The first thing they get is a prescription for medication. If you can avoid it, great. And even better is if you're on a blood pressure medicine, we should always be looking and see how can we get you off that medicine? Why are you on this medicine? Why do you need to take it for the rest of your life? So the most commonly used medicine in this country, and even in our practice when we do use medication, are the ARBs. ARBs are the medicines that end typically in sartan, right? You have our preferred one, I think the one that works probably the best and has the longest half-life is azelsartan, which also goes by the brand named Darby, but it tends to be expensive. So of the generics, probably the best is olmesartan, which is brand name Benicar. And that's great because it has such a long half-life. It works in your system for quite a long time because you want blood pressure control 24 hours a day, not just 12 hours. Valsartan is probably the second best. And the last one on our list is losartan, which is probably the most commonly prescribed. And the reason why we don't like losartan is because it's really got a short half-life and it should be prescribed twice a day. So if you're on losartan, you really should be taking it twice a day, not once a day. Once upon a time, ACE inhibitors used to be the most prevalent blood pressure medicine, and those are medicines that end in pril, like lisinopril. And the reason why we don't use them so much is the risk of side effects is a little higher on those, so high incidence of cough from them, angioedema, which is swelling of the lips and the tongue, can occur because of these medicines. So they're still used, but not as commonly. Calcium channel blockers, these are medicines like amlodipine, which is also called Norvasc. They're popular, they're decent medicines, but you want to stay at lower doses on those because there's a high risk of swelling in the ankles. So if you're on amlodipine and your ankles are swelling, go back and talk to your doctor because that's probably the cause of that. Diuretics, they're also great medications for controlling blood pressure. We use them more as an add-on to another blood pressure medicine because sometimes if you're on medicine and you're still resistant, you may need several medications. One alone is not going to do the trick, and they come in combos. We prefer chlorthalidone or indapamide to hydrochlorothiazide, but for some reason, the pharmaceutical companies, when they made their combination medicines, typically use hydrochlorothiazide in the combinations. It's just not as great of a medication. And then beta blockers, we use them last line. I mean, they're like the fourth medicine we add. They help with heart rate control, but beta blockers have more side effects typically than some of these others do.
I think a lot of people feel tired. That's the number one I hear about with that one. So we like to obviously try a few natural things in our office before we can add on medications. And I think we've had a lot of success by doing this, doing some supplements with some lifestyle modifications. So some of the supplements that we recommend is beetroot juice. And this can come in many different forms. I've heard of gummies, I've heard of powders, and sometimes it's mixed in with a few other supplements as a combo. There's magnesium, specifically citrate and bisglycinate, or also glycinate. That works great. And as we talked about before, increasing your magnesium content via foods, that might not be enough. So a supplement is nice to take. CoQ10. This, a lot of people think of, I need CoQ10 to help when I'm on a statin. Well, you don't have to be on a statin to take CoQ10. In fact, this has potential to lower your systolic, the top number, blood pressure by up to 17 millimeters mercury. And the diastolic, it can lower that by about 10 millimeters of mercury. So that's actually a pretty big decrease. A lot of people don't realize we actually, we make CoQ10 naturally in our body, and we decrease the ability to make this as we get older. Omega-3, fish oil, that's fabulous. It's good for so many reasons. Garlic, but specifically aged black garlic. This one, there's many supplements out there, including involving aged black garlic, and that seems to work really well. There's another one in our office called Carditone, and we've had great success with that one. So I want to jump into some frequently asked questions we have in our office. So are you ready?
Ready.
All right. Does caffeine raise blood pressure?
Yes, it does. Caffeine raises blood pressure, but it's a transient elevation, and there's so many health benefits to coffee that I would not tell someone to stay away from coffee. I would maybe not drink coffee before you're going to get your blood pressure measured. And if your blood pressure is persistently very elevated, then maybe back down on the caffeine intake. But yes, caffeine will raise blood pressure, but its benefits are still there.
Okay. And since I am a big caffeine drinker, coffee drinker, I will say be knowledgeable about the coffee you're drinking. Not all coffees are created equal, and not all coffees have the same amount of caffeine. So it's something you might want to look into. What is white coat hypertension?
So white coat hypertension is something that lots of people think they have, and whether or not they have it or not is a different story. But it's when your blood pressure goes up due to the anxiety or stress of having it checked in a doctor's office, or anytime you're under stress, it can go up. But typically, that's why I'm not a big fan of our office-based blood pressures. I prefer the patients check their blood pressures at home and monitor and know and keep a log of their blood pressure readings. And we find sometimes there's significant difference. And I have patients who are clearly have white coat hypertension because their blood pressure shoots up 40 points even when they come into our office.
Why is it called white coat?
Well, for the longest time, doctors wore white coats. Doesn't happen very much anymore, but I think that that term is going to stay for good.
Yeah. What is masked hypertension?
So that's the opposite of white coat hypertension. And that's actually even worse. Masked hypertension is when your blood pressure is lower in the doctor's office than it is at home. Again, a good reason to be monitoring your blood pressure at home. But people with masked hypertension, they are reported as having normal blood pressure because their office readings are normal, but everywhere else it is not normal.
This goes back to earlier we mentioned how there are many people walking around with hypertension and don't even know it. So what is the most important number? I get asked this question all the time, the top one or the bottom one?
So they're both important, but most studies show a greater risk of stroke and heart disease related to higher systolic blood pressure, which is the higher number on the top, compared with elevated diastolic pressures. Now, when you're younger, they're both equally important. As you get older, the diastolic blood pressure becomes slightly less important, and it has to do with many factors, including stiffening of the arteries and different factors. So we pay attention to both, but we typically tend to treat the systolic blood pressure more aggressively.
If somebody has hypertension from anxiety, do you treat the hypertension or do you treat the anxiety?
Well, again, I would treat the anxiety first. You always want to treat the underlying cause of everything. And people who are clearly anxious, you know it's going to affect their blood pressure a little bit, especially when they're thinking about measuring their blood pressure readings. So you always want to treat the anxiety, and preferably without medication first, yoga, meditation, like we said before. But there are medicines that have been shown to help when nothing else is working. Citalopram, which is also called Celexa, specifically tends to have more sympathetic effects than the other antidepressants out there.
All right. Is a high potassium diet safe for everybody, or how we have been recommending, just increase your potassium foods? As
a general rule, dietary potassium is safe for most people, but that is not the case with people with kidney disease or people with known high potassium levels. So it's important to make sure you're getting blood work done regularly. And if you're on any of the blood pressure medicines, you should be getting blood work done regularly as well, because some of them have the potential to affect your potassium, either make it too high in the case of ACE inhibitors or ARBs, or too low in the case of diuretics. So you want to have your blood work done and know, is your potassium level okay? And if it is okay, then absolutely, it's safe to have higher potassium intake in your diet.
Now, aren't there surgical treatments to treat hypertension now?
Yes, there are. And you wouldn't think that surgery would help hypertension, but there is something called renal denervation, which is where they disrupt the nerve signal to the kidneys. And evidence has shown that this does reduce blood pressure, and some studies have even gone on for about 3 years and showed persistent blood pressure reduction. Now, it's not huge. It's about the same blood pressure reduction as you would get with medication. But like I said before, in the case of the renal failure patients on dialysis, when you take out their kidneys, their blood pressure gets significantly better. And that's the role of the nerve signal to the kidneys. So we went through a lot of stuff, but the bottom line is all hypertension needs to be treated, but not all hypertension needs to be treated with medication. The information contained in this podcast is provided for informational and educational purposes only and is not intended for the purposes of diagnosing, curing, treating, or preventing any disease. This podcast is provided on the understanding that it does not constitute medical or other professional advice or services. Before using any products or services referenced on this podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the products. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem, or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Dr. Brian Marias, Deanna Weilbacher, and Hybrid Medical Solution, do not claim responsibility for any adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for any statements made by the guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referenced.
If you would like to submit any questions or if you have any topics you would be interested in hearing about on future episodes, please contact us through our website, www.hybridmedicalsolution.com. That is solution with no S at the end. Follow us on Instagram and Facebook, all under Hybrid Medical Solution.